want to thank you all for joining us for our January RIDE seminar. Welcome to those who are here in person and to those who've joined us on Zoom. I want to go ahead and remind you all that our next seminar will take place February 4th, and Lisa Besseman will join us from Technology Commercialization, and she'll be giving us an overview of industry partnerships. With that, I'll go ahead and turn it over to Alonso Guedes, who will introduce our speakers for today.
Thank you, Amy. Hi, everybody. Welcome to 2026 First RIDE Seminar event. So we're just starting the year season. We're really delighted with the topic of presentation for today, as well as the presenters. We have 4 of our own colleagues here with very interesting last names, so I will try to do my best here. We forgot to ask like stage names for them before they came here. But we're excited to have you guys here talking to us about education and what's going on with the curriculum revitalization and the science that's behind it. So we have Dr. Chris Hergenrader, Perle Zhitnitskiy, and thank you, Perle. I have Don Foster-Hartnett and our own Dr. Dave Brown. So thank you guys for being here. We're excited for this topic and highlighting sort of like the research and the science that's behind, curriculum revitalization as well as education, and also perhaps, giving us some ideas about future connection in terms of research in this area. That's really important as well to generate, evidence base for what we do. A lot of us that consider ourselves researchers, we're also educators, right? We're training people at different levels. And so I think this is also a very pertinent topic for those reasons as well. I want to give a huge thanks to Dr. Deb Friedman, Assistant Dean for Preclinical Science, that has been working with us to try to foster these events and really try to highlight, right, the E on the RIDE seminars, right? So E stands for education, and I think that's, again, is an area that we felt was lacking a little bit, and we really wanted them to be here to highlight that and give a sense of community. So thank you all. I will pass it to Chris. How about some clapping here for our guests? Yeah, thank you.
Okay. Can you hear me okay? All right, thank you. Yes, my name is Chris Hergenrader. I am a faculty member at the College of Veterinary Medicine and a member of the Curriculum Revitalization Task Force. Thank you all for being here. It's great to see you. We're really excited to share the work that we've been doing to develop the Revitalized curriculum for the University of Minnesota's College of Veterinary Medicine. Our presentation today is going to focus on 3 main areas. First, Drs. Don Foster-Hartnett and Perle Zhitnitskiy will talk about the foundational research that's been done to support competency-based veterinary education. Next, Dr. Dave Brown will look at the beneficial outcomes for both faculty and students of this revitalized curriculum. And then finally, I'll come back and discuss opportunities for educational research centered on competency-based veterinary education.
Thank you, Chris. Okay, so I'm going to start off talking about the foundations of our revitalized curriculum. The foundations are built on educational research. Our new curriculum is going to be competency-based, and competency-based veterinary education is informed by the work of competency-based medical education. And competency-based medical education is rooted in educational research. So a common term in education research is Scholarship of Teaching and Learning, or SOTL. And SOTL is hypothesis-driven. It's dedicated to improving outcomes in both educational practice and learning. And I wanted to emphasize that SOTL has a lot of parallels with experimental biomedical research, as Alonso was kind of alluding to. So in both disciplines, it's informed by theory and inquiry. It's driven by hypothesis and by data. And the data is peer-reviewed, and its findings are shared for peer review. So we can learn a lot from each other, those of us who have been trained in more classical disciplines can apply some of those things to educational research. Now, the goal of the Scholarship of Teaching and Learning, as I just mentioned, was to enhance the teaching quality and learner outcomes. And it was used to inform the basis for competency-based medical education, or CBME, is based on that. And I just wanted to emphasize that SOTL can also be used to assess competency-based education. And that's something that will be discussed later by Chris when we talk about assessing our curriculum. What I want to do is talk about a few papers in the field. There are actually hundreds and hundreds of research papers on CBME, and we're just going to cover a few today. So this one was published just last year in the New England Journal of Medicine, and it's by Cooper and Holmboe, and it highlights how graduates of medical and resident programs turn out they lack essential clinical teamwork and quality improvement skills when they come from more traditional-based teaching. And that is a call for moving towards competency-based education. Now, this is a great paper, and the references are at the end of the talk, so you can see them, and you'll have access to the slides. But this is a great paper in that it's really well written. It outlines the competency-based medical education, has some great figures if you're interested. So I'm going to give just a whirlwind of history here. So in the early 1900s, Abraham Flexner is an educator. He was tasked by the Carnegie Foundation to assess medical curricula at 155 medical colleges. And just from the work that we've been doing in our task force, that seems really daunting. He had no AI at the time, but he did publish a seminal paper in 1910 called the Flexner Report, and it helped revolutionize medical education. And the things that he set into motion stood for the test of time for many, many, many decades. And now we're trending towards this competency-based medical education. And a competency is a little bit different. We're not assessing knowledge per se, we're assessing a competency. And a competency is defined as an observable, measurable ability that integrates knowledge, skills, values, and attitudes. And competencies are required to perform tasks effectively in a clinical setting. So that's what we're looking for in this new type of curriculum. Now, the competency movement actually started in the 60s and 70s, so it's been around for a while. And during that time, groups of people got together and they formulated lists of competencies that would be essential for successful medical practice. The problem is that once you define competencies, then you have to have a way of measuring them. And that part is difficult. It's difficult to come up with assessments. And so it's the lack of assessments that really delayed the adoption of CBME for a while. So in order to be successful with competency-based education, we need clear benchmarks and reliable assessments, and we have to have buy-in from both students and faculty. So the goal of CBME, of course, is to produce competent physicians, and we are talking about veterinarians. Now, I don't know if you remember, but last year at Education Day, Dr. Frank talked to us, and he is a leader in CBME. He is at the University of Ontario, and he heads a Center for Medical Innovation. And one of the things that he's done is identified that there is a growing interest in CBME across the globe, but there hasn't been a consensus onto the definition of terms, the definition of goals. And so he helped form an international collaboration to clarify those concepts. And through this, we're shifting from what's called time-based learning to learner-centered learning. And time-based learning, an example of that might be that if you are a trainee, you might spend a month in adolescent medicine rotation. At the end of the month, you would be assessed and then you would move on. But in competency-based, you're not just spending a defined period of time, you're actually being assessed on how good you are at treating adolescent patients. And that that measurement is a little bit different. And one of the differences in the way that we would measure it is rather than having an assessment at the end of a month, you would be getting feedback the entire time you're there, formative feedback. And that is a learner-centered way of teaching. Okay, and then another important point that he makes in this paper is that competence isn't just a static concept. You don't just you're not incompetent and then you're competent. That competency is this gradation, or you're starting competency. There's a definition for if you're a novice and you're just starting. There's another definition as you get towards proficient. And so we need to measure that competence as learners progress. And it's also dependent on context. So a competence in an outpatient clinic might look very different, for example, than a competence in an emergency room. And then finally, so that last paper was in 2010. This is 2017. And now we're seeing that competency-based education is being proposed in many disciplines, and that it's been around for a while, 60 plus years, and there's been a dramatic growth in adoption of this curriculum. And so in this particular paper, he's giving kind of an introduction to an entire journal article that's dedicated, or a volume that's dedicated to the implementation of medical education that's competency-based. And so one of the things that that's highlighted throughout the entire volume is the conceptual evolution of how far we've come in what is competency-based education, and then what do implementation milestones look like. And those have been important to us on the committee as we're thinking about transitioning to competency-based veterinary education.
Thank you, Dawn. So if we look at our original paper that's reviewed by Cooper that Dawn mentioned at the very beginning of her section, is that if we look at the quality of the physicians that were graduating in a legacy curriculum or not competency-based, they were lacking some of those skills that we expect, right? And if you've seen me since my visit to urgent care on Monday, you probably have heard me talk about bedside manners of our colleagues and tell me, like, I think we treat our vet students better regarding communication, but that's another story here. But what this paper is actually saying is that shifting towards CBME is really required. It is necessary because the way our med students are being graduated is lacking in some of those skills and those competencies. It also warns us that it is challenging. It is challenging because it's a different ways of teaching, but it's also a different ways of assessing our students. We're talking about outcome-driven model, which means that I'm going to take a baking analogy, so please bear with me for a minute, is that if you're thinking about baking a cake, there's different ways you can evaluate your process. You can spend a long time measuring if the temperature in your oven is exactly 375 degrees Fahrenheit for the entire length for 30 minutes. You can make sure that you have exactly 350 grams of flour and so on and so forth, and never taste the cake, which is the outcome, right? And to some extent, that's what we've been doing, evaluating our students and evaluating our inputs and assessing them. And I'm wondering, well, how are they doing once they are graduating? What is the outcome? And so that's what really CBME was inviting us to do as educators, looking at our product. And I know it's a little bit controversial maybe to talk about our students as our product, but it's still, what our purpose is as a college is training the best veterinarians that we can. So it requires a lot of effort and some change, but it is a necessary one. This is what this paper is telling us. So that was all about medical education. So what does that mean for veterinary education? Well, a lot of what is being developed in veterinary education is based on that medical education model. They're both outcome-based, so we're looking at our final product, and ability-focused, which means that we want to know what our learners know for sure, right? They still need to pass the NAVLE, but we also want to know what they can do at the end of their curriculum. We want to make sure that we center on their growth, and that's what Don was explaining. So what they can do and their progress, looking at milestones and how they're going through those milestones, giving them feedback that is purposeful but also targeted, tailored to every single student so that they can improve throughout the curriculum, and looking at trusting them in their clinical growth. So our goal, just like with medical education, we want to graduate veterinarians that are confident, competent, and practice ready. So how do we do that? In 2018, the ASVMC published a report with a task force where our very own Dean Molgard was involved in creating that competency framework, right? So that framework is developed to help veterinary colleges just like ours to implement that competency-based veterinary education. It was revised in 2024, and some of the terms that you may have heard in passing or your colleagues talk about, like EPAs. So CBVE gives us 8 EPAs, or untrustable professional activities. So those activities have been determined by looking at what the daily job of a veterinarian in practice is. So there are 8 main things that a veterinarian will do on a day-to-day basis. And those activities lean on all of those competencies that Don mentioned, that are skill, knowledge, values, and attitudes. So for example, one of these activities might be taking a history, right, from a client. And so to be able to do that, I need to lean on my competency, my communication competencies, right? I need to be able to know what relevant information I need to ask from my clients, right? So a combination of competency to be able to do those activities, right? And so we want to measure that. And then there is this kind of funny word, untrustable. What does that mean, right? And so maybe if I take another example, in your research lab, we have a brand new student, right? And they need to be able to do a PCR, right? To use a fume hood and be able to do a PCR. Well, you're not going to let them do that by themselves alone for the first time they're doing it, right? So the first time you may be actually doing it yourself and have them observe. Then the next time, maybe you're sitting right there next to them, and step by step, you're telling them what to do. Time after that, maybe you're in the room doing something else and then doing it step by step. And finally, you trust them completely, and you're in your office working on your next grant proposal while they're doing the experiment in the lab, right? That's the idea. Same thing with our vet students, right? The idea is to be able to trust them that they will be able to do those day one competency, right? So those activities that are the meat and potatoes of what a veterinarian will be able to do day in and day out in a practice. So this is helpful because we go from something that we were not too sure what that looks like, right? What does it look like a day one ready graduate? Well, now we have a framework. We have those 8 activities that we can assess. Are students able to do that, yes or no? So we have those clear expectations, and then that trust piece, because this is what employers want. They want people they can hire and they can trust to do those things that are really common, and they want to be able to trust them for them to do them uncommonly well, okay? This is a figure that basically summarizes everything that I just said, right? So here is our goal in the middle, that circle of practice-ready veterinarian. We need to integrate, right? So We're taking all of those competencies, we're combining them together in those activities. We're talking about different disciplines that are working together to train our veterinary students. We want to make sure that we tell them that this is a process. They're going to go through milestones. They're going to get better. So we want that growth mindset in our students and the entrustment. We want to be able to trust them at the end of their program. So where are we at with the implementation of that competency-based veterinary education framework? This is that next paper that I want to talk to you about, and you can see one of the co-authors on that paper that is a face that you all recognize, our very own Senior Associate Dean for Academic and Student Affairs, Dr. Erin Burton. And so at the time of this paper that was looking at the CBVE adoption across different colleges in the United States, they had 34 answers to that survey, and 20 were already using a framework, and 11 were using the AVMC CBVE model, and 12 were planning to implement it in the next 3 years. So as we are doing this work here at Minnesota, working towards the implementation of that CBVE framework, we're not alone in this journey. And really, we have a lot of colleagues that we can lean on. The challenges that were highlighted on this paper were similar to the one with the medical education literature review that we mentioned earlier, that Cooper paper, the timing, the resources, and change management, because it requires some change in how we think about teaching our students. We need support, so that translating those milestones on how students progress, as they are learning and are becoming better in their journey to become an independent, competent, and confident veterinarian. How does that look like, those milestones that they need to go through in coursework, new assessments, curriculum mapping, and progress guidance were also highlighted as things that we need to transition to that curriculum. So like I said, we're not alone. And so if you recall, in one of the education day, I believe it was 3 years ago, we had two people, one from Wisconsin and one from Louisiana State University, that were talking to us about how they went through their own curriculum revision and how they implemented CBVE. So that's resources that we have as a task force to lean on, but we also have been meeting actually a couple of times each with the associate deans for student affairs at the Ohio State, Penn, and St. George's, who have been really helpful in guiding us and helping us understand how they actually implemented that change from a legacy, more traditional curriculum to CBVE.
I'm all set. Yeah. Oh, this. Thank you. Thank you. Thanks for coming today. I'm David Brown. I just taught a class in here for 2 hours on local anesthetics, so I'm in my teaching uniform here today. So I'm going to talk about outcomes. And first of all, I'd like to, step back a minute here, because what I want to show you first is we've laid the groundwork for a lot of these changes in the past. So we had, for those of you who have been around for a little while, 12 years or so, you may remember we had a curricular revision in 2013, of which we had 2 representatives from each department kind of involved in that, and I was one of those from my department. And so we launched a bunch of things. Among them was these integrated courses. So we started to think of, instead of these kind of more siloed courses in parasitology and all the ologies, started to think about, well, what are the common features, say, infectious agents, for instance, that we could teach the students, that basic concepts first, right, in an integrated type of course. And that's where we came up with, and that's not the only one, but those were some of the integrated courses that were kind of thought up and kind of developed by faculty from this 2013 last revision. We had mini rotations that were begun. New courses, new structures were developed, including team teaching, of which I got involved in that. We have a antibiotic teaching team. I have the pleasure to work with outstanding faculty from other departments, and and the students have benefited, I think, from that. We had a semester coordinator, which is really important. This is the first time we had someone that's looking at the curriculum horizontally and vertically. Horizontally along semesters, vertically, and that person could then take concept topics across courses and kind of arrange your schedules so things would sort of begin aligning across courses within a semester, see. So we're beginning this integration, but it's across courses right now, right? So we laid the groundwork for this in 2013 and it's progressed. So some of this is already being done. Then in 2017, there were a number of initiatives started here, the Thrive in Professional Development and clinical skills initiatives, training and so forth. We started to have report, a better curriculum committee, a small task force that kind of came up with an idea of how to progress with this new curricular revitalization. And faculty we're listening to faculty, and there were, as I say, some people that have been through this process right from this first report, really. In 2020, the college started a strategic planning process, which involved things like building the collegiate community, strengthening it, more collaborations across departments, across disciplines, et cetera, in not just research, not just like lab research, but also education and instruction and things like that. And there have been focus groups, and many of you participated in these. Then we've undergone curricular revitalization processes for a few years now. So there was a first task force that kind of laid the groundwork for this, how to proceed. Second task force, we started asking questions like, what is a day one veterinarian? What are the attributes, et cetera? And then task force 3 is more like scaffolding of the process, right? Like, what can we start to build? What stage 1, stage 2, stage 3, to use Perle's analogy to a cake, we have the 3 tiers of a cake, perhaps. This big foundational tier, and then the medical kind of tier, and then the kind of professionals, what it takes to finally launch out and go into practice. And we've been actively seeking your feedback, and many of you have really been very good at providing comments and so forth for that. So we have an outcomes-based practice-ready veterinarian type process now, or framework, and a consensus on what is important, what are the needs to produce this competency-based medical education model. Okay, we're not alone in this, and so part of my little delivery here is going to be, we have support, okay? There's support for this. We're not doing this alone in isolation. As has been alluded to by my colleagues here, there's a lot of consultation going on externally. There's a lot of things going on at the University of Minnesota. The medical school and pharmacy are doing this, have done it. They're launching it, and they're doing experiments along the line. This is not a static process. This is not one and done. This is dynamic, kinetic, adaptable. It's going to change because the future is going to change. Veterinarians are going to be called on to do other things, so we've got to make this flexible and adaptable. And that's what they're trying to do in pharmacy and the medical school as well. So we have consultation right within the health sciences here, and then all of our colleagues in colleges of veterinary medicine. As I said, we've done a lot of conversations. We're going to have some more town halls coming up in February for more opportunities for feedback. But we're starting to get more granular now, so we're going to start looking at content and where would content be best placed, in what context. And there's going to be some advantages to this for people, for instructional staff, faculty, instructional, everybody that's involved in instructing veterinary students, as you're going to see. We want foundational basic scientists to be working with clinicians. We have tier one, like fundamentals, right? Foundational, specialty courses, case studies, working together to introduce these basic science concepts that are so important as the underpinning of medicine, right? So we need to have those conversations. We need to have that collaboration. Specialty courses, maybe in your discipline. Case studies, and then leading into the new curriculum, breaking down these content silos, okay? So these ologies, we got to make them into integrated courses in a context. So it'll save a lot of time. It'll save a lot of repetition and things to do that. There's a lot of advantages to this. Integrating this content vertically and horizontally so you know exactly who's teaching what is being taught, when, where, how do I fit in, and team teaching. So we're all, if you're doing bench science, basic science, so, it's good to be an independent investigator. It's always good to be a team scientist, too. It's good to be part of a collaborative team. And team teaching, someone else has part of your back. You're not doing this all by yourself. So support, again. We have support of our educational community here in the college. So the outcomes for faculty, and I would say this is instructional staff, really. I'm going to call it instructional staff, because that's really what it is going to be in the field of educational research. So you all have probably written grants or designed projects and successfully executed them and got outcomes and new results in your disciplines. Well, you can do that in educational research as well. Chris is going to talk more about this, but I would say this is an opportunity. We have a brilliant opportunity here with this completely different model to really contribute to the advancement of veterinary education through educational research. And if you're in a particular discipline and you go back to your society, they may have a teaching or educational committee that they'd love to hear what you're doing in this field and in veterinary, if you're in a microbiology society, maybe less veterinary schools are represented there, you're kind of unique and you can contribute a lot of comparative things and so forth. So I think it's advantageous in a lot of reasons. You get teaching grants, and teaching grants aren't $1 million grants, but they're lauded. So you get $5,000 or $15,000 to do something, or 20, that's a feather in your cap. So I'll let Chris talk more about the educational research, but it's going to be very important. Manageable teaching loads. Again, reducing repetition. I don't know what everybody, I could be teaching something and that's taught 4 other times. There's a review or something that's going on where 5 slides in a lecture are a review of material they had before instead of right in the context when they needed it, right? So manageable teaching loads. Meaning that not only the content will be reduced because of repetition will be reduced and maybe more honed toward the practice-ready veterinarian, but also you have support. You have a team teaching more, so you have somebody watching your back a little bit more, right? And then collaborative teaching, and the rewards for collaborative teaching and team teaching are amazing. I mean, I learned so much from my colleagues. Then we also, if we have a curriculum map, finally, a really good, we'll have this design so we actually know exactly. I mean, the semester coordinator knows, but I don't know what's being taught in year 4 or whatever. No, we have a curriculum map. We have a real good guidepost that's going to really help us understand the college and what's being taught and so forth, and where we can tweak and things. Awareness of what we are teaching and why we're teaching it. Is it important, or was it just extra things? And then breaking down these silos, really important. So it's really, we need the support. We have faculty in the college. So you want to do educational research. We have faculty in the college to do this already. We have core groups of people that know how to do this, so you don't have to wade in on this on your own, right? They can help you develop questions, related to things you might be interested in and so forth. And again, Chris will talk about that. Just looking to see if I had anything else. So better awareness of what is taught and how the students are progressing through their training is really, really important and rewarding. As far as the students are concerned, well, they're going to be a whole lot more confident when they walk out of here, right? So clinical competence and confidence are going to be really, really important for them. Manageable course loads, reduced stress. They are quite stressed out sometimes with their courses and things, so better course load. We might not need a semester coordinator as much, too. We can, because we have this thing maybe in a scaffolding now. Collaborative and team-based learning, students teaching senior or the older students, the more advanced students teaching the more junior ones, for instance. Yeah, the only way I learn anything is through teaching. So I'm sure the students could do that as well, right? And they do a great job doing that when they do it. A functional curricular map, again, for them to navigate through. Awareness of where they're headed as ready to go out into practice. Much more, we're building skill sets, we're building awareness of career goals and trajectories and things as well. And then, of course, success at the NAVLE, really, really important. So we have these upcoming town halls coming February. Please try to come. There's the thing you can use. I don't remember what they call that, but what is it? QR code, yeah, the QR code for this. And there's our stages. I didn't want to get into all the specifics. Okay, I think I'm going to be turning it over to Chris next.
Okay, well, thank you, Dave. Yeah, so I will build off of what Dave, Dawn, and Perle spoke about earlier regarding the foundation of competency-based veterinary education. And we're also going to note that we're going to have that opportunity moving forward to dive deeper into educational research ourselves. And I think an important stage of that is going to be evaluation of the effectiveness of what we're doing with our revitalized curriculum. Okay, our first opportunity to examine and compare the results from two assessments students have historically taken during veterinary school, both of which are developed by the International Council of Veterinary Assessment. The first is the Veterinary Educational Assessment, or the VEA. That's going to be taken at the start of the third year currently, and it's going to test for foundational knowledge such as anatomy, physiology, pharmacology, microbiology, and pathology. So kind of a midway point of the veterinary education. And then as Dave mentioned, the second test is, of course, the NAVLE, the North America Veterinary Licensing Exam. As the name implies, and as we know, this is a licensing exam students need to pass in order to be practicing veterinarians. Students take that test during their fourth year. The content area and exam structure is based on a blueprint developed by the governing body there that is going to base itself off of practice analysis to determine the tasks that veterinarians perform in practice and the knowledge that is required for the competent performance of those tasks. So both of those exams go well with our milestones and where we're leading with that competency-based vet education. So we'll take the results of those two assessments and from surveys that we give to our graduates and the employers that hire our graduates, and we're going to break those down into data from students who learned under the legacy curriculum and the students that, compare it to the students that learned under the revitalized curriculum. Analysis of that data then is going to help us to determine the effectiveness comparatively between the two curriculums and be able to make apparent areas for growth and further development with the revitalized curriculum. In addition to those, we've got an evaluation project scheduled upon completion of the first year of the revitalized curriculum with the Center of Applied Research and Educational Improvement, which is a University of Minnesota research organization that is focused on bridging the gap between educational research and practice. So we'll get through that first year and then we'll start an evaluation process with that organization to see if we're meeting the things that we're trying to do. And then also, as mentioned previously, through SOTL, Scholarship of Teaching and Learning, educators are going to have the ability to and be encouraged to individually and collaboratively work on educational research projects with the support of the college and the university. So how are we doing individually? How is the college doing as a whole in preparing our students and increasing the competency and confidence that they're graduating with? Okay, so an example of the type of research we could do as we're moving through the Revitalized curriculum and implementing it is here. The thing that we want to remember, as alluded to earlier again, is that educational research is research. We may not have laboratories that we're performing this research in, but we have classrooms and we've got students that we're looking at. So we could examine, for example, the impact on competency-based feedback and how that competency-based feedback improves the confidence and competence when compared to more traditional grading in an integrated program. And a couple of examples of competency-based feedback. One that we're probably more familiar with are the OSCEs, the Objective Structured Clinical Examinations. They're going to be looking at effective completion of skills and things that those students are going to need moving on. But also we've got something called a concept inventory. And another example of things that we could utilize. A concept inventory is pretty cool, and it's utilized both before and after we present a new skill or new knowledge. The before assesses where the students are starting, and it looks for misconceptions or things that students aren't as familiar with, or maybe things that they think they know, but they don't really know correctly. So we utilize that information to structure our teaching, teach, and then assess after our teaching has been completed to see if how we've done in alleviating those misconceptions. Okay, so just a couple of examples of the type of tools we could use in more of a competency-based educational program. And for individual educators, again, remembering that educational research is research, and so our design concepts would have to be similar to what we traditionally would see in maybe a more lab-based research. So, for example, considering what design we're going to use, considering the data sources, where are we going to get this data from, what are we looking for, what instruments are we going to utilize to gather that data, when do we utilize those instruments, when do we try to get that data to both maybe pre-data, maybe post-data, but whatever our timeline is to effectively be able to get usable information. And then how do we analyze that to make sure that what we've got is helpful, make sure it's valid, and that we can build off of that and utilize that information for improvements. Okay. Here we go. I say here the process has been both challenging and professionally invigorating. I think that's a good way to summarize it. And then the other thing I would leave you with here is how exciting it is, though, to think about what's possible with this new curriculum. So that's what we've got for you today. We thank you for your time, and we'll be happy to open this up for questions.
I wonder, given that I'm, in full disclosure, for those of you that don't know, not a veterinarian in any definition of the word, but I assume that veterinary medicine, like anything else, is sort of fluid, and of course over the career of our students, right? They're probably going to have long careers. So is the ability to learn new things a competency that could be integrated? Because there may be new diagnostics that don't exist today, but may exist 5 years from now. And so how do we sort of integrate that idea into a competency, being able to, as like a lifelong learner, for example, as kind of a broad term?
Thank you, Kevin. That's a great question. So we didn't go into the detail of that CBVE framework, but within the competencies, there are 9 different domains, and domain 7, 8, 9, 5 and 6 too actually are more on the professional development side of things, with the communication, collaboration, but there is also a competency in there with specific milestones regarding lifelong learning. So I think that's one aspect. So it is including in the framework, so that's good because it keeps us it helps us keep that in mind, right, as we think about this new curriculum. But also, I think the growth mindset aspect also helps us with that, right? Like that there is this continual improvement, and that's something that we really want to make sure that our students keep in mind. Like what we are teaching them today, part of it will be wrong, right, by the time, like 5 years after they graduate. And so that's maybe a little bit depressing for our students because they spend so much time, learning, but it is true. So, I think that's a very valid point and something that we need to keep in mind. Yeah, sure, go ahead.
And I'll just add some of the ologies. Pharmacology is one, but there are some other ones now that have come up with core concepts for all healthcare professionals, plus competencies, including in pharmacology now tying pharmacology competencies to this framework. So it's already there are groups doing this in societies, including, and it may be also in your particular discipline as well, like in microbiology. I'm sure ASM is doing some of this. So some of these are already ongoing, and you can be part of those groups if you're interested, because they really dig into then what's going on in these other schools, how we can, and that'll help adjust to the future as well, right? So these are dynamic. So as things change, those types of that information is going to be maybe included through those societies as well. So just point that out.
All right, plugging in one more question here. So this is really amazing. There is a lot of, so like we think about teaching and outcomes, right? And I'm thinking about the biology behind this. This all has to do with neuroscience, memory formation. There is cells involved in this, cellular processes, proteins. I'm not sure, lots of different things happening there. So I'm just wondering if and how you can integrate some of our deeper sort of like techniques to look at memory formation, those things. I'm thinking about like functional MRIs, some of those things that can actually potentially give you some sense of where things are going much earlier than waiting, say, 5 years or 10 years to look at the outcome. And those things are still important, but I'm just wondering, can you go a little bit deeper and use some of those more advanced, neural type techniques to get to some of the answers to, how you are approaching the teaching on education teaching?
Sure. Yeah, that makes. I say that, I don't mean to be flippant about it, but I think that's a really good idea. And I think that's what we're hoping to accomplish in the sense of what tools do we have available to do this well, and what tools do we have available, to make this as good as it can be. We look at it in a way of kind of starting with a clean slate too, and we hope to not be beholden to the quote unquote legacy curriculum or old ways. And so fresh ideas like that, I think, are really, really helpful.
Great, thank you, Chris. And then I was just thinking about, can you sort of like put some of these ideas, this hypothesis into like an animal model where you can generate some of this data maybe a little bit sooner before you kind of implement on a veterinary curriculum, for example. I'm not sure, dogs are super smart at learning things, and we all have dogs. And I'm not sure, like, can you potentially address some of these questions using animal models and different techniques?
So I just want to ask a clarifying question. Are we talking about doing MRIs on our students then? Because I'm just thinking from an ethical standpoint, there's probably something to work out there as well, right? But no, I think that's a very valid point, like getting into more of the biology of memorization. Yeah.
I have an easy question. What we often talk about redundancy in the curriculum, and I'm just curious, like, how much redundancy is there in the curriculum? Like, what time can we recover? Like 10%, 25%? Because we talk about it a lot, but I've never actually seen a number associated with the percentage redundancy in the curriculum.
So Dr. Burton just left, but in one of our meetings, she said, and that stuck with me, that our students get 20 hours on parvovirus in our curriculum. And that feels to me huge, 20 hours, right? And the problem is that it's not scaffolded, right? Like, because maybe I'm talking about parvovirus and Dave is talking about parvovirus and Chris is, and we all start from scratch versus we are building and making something intentional. So I don't think we know exactly. And actually, if you come to the town hall, we will have a little homework for some of you thinking about looking at what you teach, and that will help us having a better mapping of our current curriculum. So this is my shameless plug to please show up to the town hall meeting so that we can tell you more about what we need from people who are currently teaching so that we can identify that. I think we are hoping to cut back the number of hours based on that redundancy, but also being more intentional of what is actually needed for a student who graduates and being day one ready at the level of a general practitioner, right? I'm not talking about training specialists. We want to train at the GP level. They have all the time in internship and residencies to do those next steps. So we're hoping by the combining those two and being more intentional, we can reduce their workload, but also ours as well.
Yeah.
Yeah.
Yeah, that sounds great, actually.
Thank you, Rem. Yes?
So one of the problems with the old curriculum was construed that we teach about a virus from the vantage point of these foundational courses. And then when students go to a medicine course, they're getting something that might kind of clash. And I think it comes back to defining what we are trying to achieve in any given course. And I think all of us want to give the students the right sort of structure so that they can hang some ornaments on the Christmas tree and then go on and get, with that covered, go on and build on it. So we're also hearing about some really great ideas about research. So I can just see what we can, it's really clear what we can do, but how are we going to do this research? Are you going to, are we going to have people just randomly step up to do research and be PIs on doing neuroimaging? I'm sure Alonzo would love to do that. But is that so? Are we going to, or should we talk about how we're going to do it?
The first step was kindly being invited. I think I'm going to talk for myself here, but I think my colleagues would agree that we are very excited to be here, at the RIDE seminar and be able to talk about that and the opportunities, right? So how do we get there? I don't know, but there are a lot of very smart people in the room. So I'm hoping this is just the start of the conversation and that we can continue. I think there is from an administrative standpoint, I think there is really that excitement and this idea of University of Minnesota being a leader in the space of educational research. So I think there is a lot that we can do. But I don't have the expertise that Alonzo has on MRI. No, but I can talk about teaching methods. That's what I can bring to the table and we can have a conversation about it. So yes, it is exciting. And I'm hoping we can get something going here.
Abby and I put together a survey for our first-year students to ask them how much experience and what their thoughts were about knowing concepts of sterility or aseptic technique. And then we had, I developed 2 sterility labs over the summer, and as a team, we ran through the labs and figured out what to do when and all these concepts and things like that. And so I haven't looked at the survey results yet, but we've also been collecting data from our mass excision assessment, which we do every year with year 2 students. And I think that's going to be very interesting to see how, if some of these changes we make early on, how it affects their scores and their readiness. So there are ways to do this fairly simply, but you could do MRIs as well. But just saying that don't be as afraid of it as this giant task that no one does. It can be as easy as a survey and then comparing students from year to year and what you did and what their outcomes are and those kinds of things. But I'm really glad you're doing that first year post-grad and 5-year post-grad surveys, because that's the way we really know. And then just a plug for clinical skills, that I think it needs to stay all throughout the curriculum year 1, and that we should schedule practice time instead of stuffing it in, when we can. Thank you.
Please come back to the town hall.
I'm going to come to all of them.
I guess my question is, what is the timeline at this point? When would we be seeing the new curriculum? when will we see that roadmap that you guys have mentioned for the curriculum of like what year 1, 2, 3, 4 look like?
So I'm gonna say it in the microphone, right? But the implementation for the first year of the new curriculum is planned for fall 2027. So the first student who will graduate having the whole new curriculum is 2031. So it's not tomorrow. I just want to say, because you're a current student, like we don't think that what we're doing right now, like anything needs to go, right? I'm still very proud of the curriculum that I'm currently teaching in, and I think you're still getting a really great education. I just think we can do better, especially on our assessment on how prepared you are for real life. So, yeah, please don't be too worried.
Excellent. Let's give all of our presenters a warm round of applause. Thank you all.